Nairobi recorded 32 cases, Nakuru 24, Kisumu 22, Garissa 14, Mombasa 10, Meru 8, Kajiado 8, Kisii 6, Bomet 5, Kiambu 5, Siaya 3, Uasin Gishu 2, Kilifi 2, West Pokot 2, Marsabit 2, Muranga 2, Kakamega, Bungoma, Nyamira, and Kitui 1 each. On a positive note, 168 people have recovered from the disease, 105 from the home-based care program, and the remaining 63 discharged from various hospitals. Our total recoveries now stand at 24,908, and I want to thank our healthcare workers for this great achievement. Unfortunately, at the same time, we have also lost 4 patients to the disease, bringing our total fatality to 711. Once again, our sincere condolences to the families and friends of those who have lost their loved ones. Thank you. I cannot hear you, my dear.
All right, my name is Dorcas Wangira from Citizen. What is the status of our curve? How is it looking like? And then also, the Kenyatta National Hospital, I understand they have suspended their strike, but what would have been the impact of such a strike even in the few days that we had, because we saw patients who are not being attended to, and what interventions will the ministry put in place to ensure that something like that doesn't happen again? And lastly, how is the community spread looking like in the counties?
Okay, thank you, Dorcas, for that question. With regard to our curve, of course, we're watching it very carefully. I think we are still around that, the key number which we are looking at, which is maintaining our positivity rate, preferably below 5. And I think if we look at the numbers, we are around there and have been there for a while, which is a good indication, but we need to maintain it. It can very quickly pass that threshold and shoot up. And I think we do see sometimes small fluctuations here and there. But if we look at the 7-day moving average, I think we have been just below the 5% curve, which is a good place to be in, and we need to maintain that. And to maintain that, we need to do the things we keep talking about when we are up here, the information that we are providing to Kenyans, the pleas that we make to Kenyans on adhering to those containment measures, the ones that we are directly responsible for: wearing masks, washing our hands and observing hygiene, keeping social distance, avoiding gatherings. All of those contribute to us being where we are on that curve. On KNH, yes, indeed, there was that strike, I think, for the last 2 days or so. I can inform you now that that strike has been called off. The workers have had discussions and negotiations with the management following the court case which put a stop to that activity. There have been discussions, fruitful discussions, and the workers will be going back to work from tomorrow. And this will allow time also for the Salaries and Remuneration Commission to be able to be given the time they had requested of 3 weeks to be able to provide now an advisory on the matter and the way forward. And we hope that that will turn out positive. It is not desirable to have any strike by healthcare workers at this point in time where we are. We're in the middle of a pandemic, and I think the workers also do realize that, but of course they may be pushed to some limit for one reason or the other, and there has to be some level of sanity and negotiation and discussion. I think we have achieved that. Again, we still want to implore upon our healthcare workers that we do value what they're doing. They are the frontline workers. They are the frontline soldiers battling this virus and protecting us from this virus. And we surely don't want them to be in a position where these services are disrupted. So that is our plea, and we'll continue to work together with our healthcare workers and those representing them in their in whatever grievances that may have, that we can address this in a proper manner. Your last question, remind me, was on? Yes, community spread. Well, we are not seeing, we are still maintaining the levels of community spread that we have been seeing over the last several days and maybe into weeks. We are watching very carefully spread into some of the counties that may have had lower numbers before.